Hey everyone, Jeff Horowitz with Dentists in the Know. We're at Chicago Midwinter, and one of our best friends has shown up, Dr. Layne Martin.
Good to see you, man.
This guy is not only a great dentist, he's a hero, he's an innovator, he's my kind of guy because he is someone that is always thinking, how do we make this better? And so you and I got to know each other a couple of years back. Both of us very much immersed in the orthodontic, the TMJ, and the sleep world. And the second we met, we knew we had to be doing some stuff together.
Yeah.
So why don't we start by maybe telling the audience what some of the shortcomings you saw in the orthodontic field, in the sleep and TMJ fields. Well, you saw some things that needed to be done, and you did something about it.
Yeah, so obviously you and I met. I've watched you lecture. You've been a mentor of mine along the lines of John Coyce, Larry Rosenthal, Michael Gelb. So it's always like I've learned from some incredible people. And on the restorative dental side, it was more of like doing full mouth rehab. Why were these things failing? And pretty much every full mouth rehab I've done, there's been some type of failure. It was the same thing of like me lengthening a 6 mm central incisor and chopping someone's mandible back.
Right.
Things that I never really fully understood. Then I kind of sold my practice, went into the ortho field, met Michael Gelb, who you know really well too, and realized his lower repositioner is what we do in ortho.
Right.
But a lot of the orthodontics is really retractive ortho. It's so many of the patients that I see now, unfortunately, that just got out of Invisalign, clear aligner therapy, they have jaw pain. They have airway issues. And that's something that you are such an incredible advocate of. And Michael and I are right there standing side by side with you of saying like, hey, we need to do better. Ortho, wider and forward. Get someone's mandible in a better position. Do we want to keep chopping people's jaws back? Things like that.
Yeah.
And it's like, how do you overcome those things? And I gave a talk today. Somewhat controversial statement is that doing a sleep appliance is really just a better night guard. And I think you and I have spoken about this because it's like maybe there's 3,000 or 4,000 dentists that are like you and I that are diplomats of the American Board of Dental Sleep Medicine. But there's 220,000 dentists that do night guards.
Right. And that's something we've been trying to get the message out about, because we also know that if night guards are not made correctly, that they can have the opposite effect. I mean, in the Journal of Prosthodontics, there was a great article about more than 50% of all cases where night guards are made, if they happen to be apneic, the AHI can get worse. But if it's made correctly, it can absolutely improve. So I think that's where you've put a lot of thought into the appliances with Michael Gelb. So you developed an appliance, right?
We did. And, you know, it's so funny because I remember you talking to me about the bite that you took. And I really think you really had it right. And I think the rest of us really had it wrong. And even yesterday when you told me about like the cotton
that's
rolls,
something my wife has never said to me. So thank you, because I never get that at home.
All right, well, that's just for us.
Yeah. Okay.
But you brought up such an amazing point, Jeff, of like, you know, we'd use all these apparatuses to take someone's bite, to put these big bulky things in people's mouths, when at the end of the day, it really comes back to something like Invisalign. You could put a clear aligner in anyone. It's just the premise of all these appliances to prevent their jaw from falling back.
Right.
And what you said with the bite, it really made a ton of sense. Like I walked away even yesterday when you said it, and I was like, you know what? He's right, because it becomes a curvus spee issue. And
what Layne is referring to is no, it's great. Just in case anybody doesn't know, I'm a big proponent of posterior vertical versus hinging everybody. And there are some that hinging works great, especially if the joints are healthy. But there's a lot of unhealthy, as you know,
absolutely,
working with Michael Gelb, there's a lot of unhealthy joints out there. And for those patients, getting the bite with posterior vertical can not only unload the joint, but also have the benefits to the airway at the same time. So that's what Layne is referring to.
And it's really brilliant, and it's really of the way to simplify it.
Yeah. So, tell us about the appliance that you're working on right now.
So the appliance that Michael and I developed has gone through several
Yeah,
iterations, several connectors. You know, I was thinking more on the ortho side. I didn't want it to be a class 2 elastic. I showed you our new version. We're going to probably be making it in nylon, and it'll be titratable to 6 positions. The connector will be TPU. It'll be a lot easier to use, a lot more comfortable. We're going to
yeah,
probably print at about 1 millimeter, where clear aligners are 0.75 millimeters. So I think with working with people like you, doing some clinical trials, getting the feedback, I think we're really on to something, because at the end of the day, you got to get into bed, you got to be comfortable. And that's
right.
really the effectiveness and efficacy of how these things really work.
So the next thing that I see is I think there's an issue in education about this because, and we've talked about this. This is not about having sleep dentists, TMJ dentists, orthodontists. All of this kind of falls into this pool of functional dentistry. And I think anyone who's doing any one of those things, whether you're just doing basic Invisalign or aligner therapy, I should say, whether you're just doing that or whether you're just getting into sleep or whether you're just getting into making night guards for your 3D printing night guards, I think there has to be an understanding of all those. So what are you seeing? Where are some of the places that you think our dentists could get better education on these topics aside from coming to my courses?
Yeah. So I think it's an amazing question. I think that we need to be better educating. It's got to start at the schools, and good luck with implementing there. So, what's the next step? I think you have to do what Invisalign did. I think you have to go direct to consumer. I think you have to partner with some of these companies that are doing salivary testing. It's got to be about wellness.
Yeah,
People see their dentist more than they see their physician, Jeff.
yeah,
It's a captive audience. And it's not something where, I was just talking about this with someone. AI. AI is a hot topic here. You're hearing it here at Chicago Midwinter. Well, guess what? The easiest thing to implement AI is Airway and sleep. You don't have to have the patient even sitting there. It's not like, oh, let's look at their radiographs. You
yeah,
ask questions. Are you aware that you snore? Do you have high blood pressure? Acid reflux? Could you be more refreshed? Even generating that, get them a sleep test. Think about starting it there
right.
and then being able to implement it. And I think people want answers. They want to feel like, all right, this person cares about me. It's got to be more than just doing fillings and teeth. So
Yeah.
I don't know the right answer for that. I think going to the consumer is part of it. And I think trying to implement it into the dental schools is really a big part of it too.
And that's tough. That's not an easy
No.
task. So, on another note, you've had some other innovations in the world of sleep.
Yeah.
I don't think you ever sleep. You created a pillow.
I did.
All right, so let's
And
talk about that.
So the pillow was really out of necessity. I was treating one of my best friends with our appliance. He was doing amazing, and his wife said he was starting to snore when he was on his back.
Yeah,
Well, my other best friend's an ear, nose, and throat doctor, and the two of us were treating this guy. And my friend Jason's like, "Well, tell him to put a tennis ball in his t-shirt." And I'm like, "Jay, I don't think you understand sleep. When he rolls on his back, it's going to wake him up."
yeah,
He's like, "Well, what would you do?" I said, "I don't know, a pillow." I drew it on a piece of paper. We 3D printed it, my buddy from the
yeah,
Navy, and I made our first pillow. And we actually got some really good results. My new partner is an Air Force veteran who worked for Tuft and Needle and in the pillow sleep industry. And our pillow has morphed into this like incredible product now.
yeah.
And yeah, it's super fun.
Not
Everyone's
just
already-
for people with sleep issues,
It's
right?
not. It's really-
orthopedically probably healthy as
Exactly.
well.
So
yeah.
I dedeveloped it for snoring and performance. Now
Right.
I did a clinical trial, and then I just had a third party do it. And we've gotten a decrease in 60% in snoring, 47% in apnea hypopnea index just from
That's
a pillow.
amazing.
But most of our reviews, to your point, it's about no more neck pain, no more shoulder pain. We're sleeping better. So
Yeah.
everyone doesn't have the luxury to come see Jeff Horowitz, but everyone's already sleeping on a pillow. And that was kind of our premise of like, let's just get people sleeping better.
So for dentists that are doing sleep or dentists who I know for one that I try to be a health care advocate, not just their dentist. So, I'll preface any statement I make with, this is not my area of expertise, but I know of a great product that has been shown to, do some great things with regard to neck pain and improving sleep. So I like to always offer these things. So for those dentists who are doing sleep or just wanting to make a recommendation about the pillow, where would they go?
So it's called OpenAirPillow.com.
Yeah.
They can go on the website. We're almost sold out, so we're getting more inventory. And you brought up a great point. I always say to people, snoring and sleep apnea is an incurable disease in adults. It's like diabetes. How do you treat diabetes? You mitigate symptoms, insulin, diet, metformin. With snoring and sleep apnea, the beauty of dentistry is, think about it. How do you treat snoring and sleep apnea? CPAP, upper airway stimulation, which is Inspire,
Right.
or a mouthpiece. The beauty of what you've taught me and what you do every day is orthodontics, giving someone more tongue space, getting their mandible in a better position, or better restorative dentistry in a better position than the way that I did it.
Yeah.
So I think that it's really about multiple things. It's multiple adjuncts. And that's all we were trying to do. I was like, all right, I'm going to try to innovate because I see it. I have the problem. All my friends snore. They all have airway issues. How do we fix it?
Right. And the nice thing is that now the public is coming to us finally to talk about these things. Before it was like, why is a dentist talking to me about this? Now it's, hey, I heard you do this. And it takes a while. And some of us had to stand on the hill and fight the battle. But the great thing is that now there's a public that realizes that dentistry is here to help with other medical issues as well, especially when we are the gatekeepers of joint health, of upper airway resistance. We are the gatekeepers for those things. So.
Yeah, so I actually have a question for you.
Okay, let's do it.
So do we
need to sit on opposite sides of the table?
Never.
Okay.
I can't take your shoes, man. In terms of salivary testing, do you do any of that in your office now?
We used to do a lot more. So, I backed off a little bit on the restorative.
Okay.
So, but it's something that I think that is absolutely critical.
Yeah.
I think bacterial profiling is huge, especially implantology, surgery. I think we've got to understand what it is we're battling and how we individualize treatment for our patients. And that's where dentistry is going, is more individualized care, not, you get 4 quadrants of scaling and root planing, and we can't treat patients.
Yeah, so I ask it because a company approached us, and I was just really curious about it because it was really based around oral cancer screening, but then they also said there's a way for them to even evaluate sleep apnea. And obviously, you're a pioneer in kind of all that. And I didn't know if you were utilizing it for that or what you've heard.
Yeah, I mean, there's a lot of people right now that are stretching. The first one that comes to mind is what's the weight loss injection? It's
Ozempic.
It's one of those.
Oh yeah, sure.
PLG-1.
Yeah.
And they're making the claim that it can fix sleep apnea now. And there are patients literally walking into my office. I'm like, no, it can help you lose weight, which may or may not be the cause of your sleep apnea. So, we have to be really careful and let the data come in on a lot of these things before we jump on them. I'm like you. I love being a pioneer, but I also want to be able to plant my heels firmly in the ground and say, I got a good reason for doing this. Not just I have a hunch.
Yeah.
So
no, absolutely.
There's great stuff. What else you want to talk about? Put you on the spot.
Where are you going for dinner tonight?
So tonight we have a party with Evolution Dental Lab, and it's going to be quite the spread. Excited about that. And when do you head out?
I fly out tomorrow. I'm seeing patients Monday, Tuesday. I fly to Florida Wednesday. A lot of moving parts. How many subscribers is Dinks up to now?
It's beyond all of what we've done on Facebook. Now, what's really taken off are the podcasts.
Yeah, it's so smart.
And the YouTube views.
Yeah.
So even just the podcast, which hasn't been on that long, we were 30,000 downloads already. So
Amazing.
that's people want their information like this. They want to hear regular clinicians talking it out. You know, maybe you say something controversial, maybe you don't, but just having real world conversations.
Yeah, and I think
in short blips.
and I love that. And I think the thing I love about you guys, and especially I say it all the time, my favorite slide on my presentation is the Eleanor Roosevelt, learn from the mistakes of others.
Yeah.
Can't live long enough to make them all yourself. I literally stood up today and said, I have screwed up every part of dentistry. I have screwed up our appliance. I probably even screwed up our pillow until we got it to where it was.
Yeah.
So I think the platform that you guys built is really incredible. I'm kind of flattered to be part of it. And it's just to your point. I think the podcast thing is so the future of us learning, of us kind of advertising, of marketing. We just did it for our pillow. And one of the guys that he's a sleep podcast. He reads stories. It turns out, an incredible story. He was an alcoholic, insomnia guy that just couldn't sleep. And when he spoke to us about like our pillow, our mouthpiece, I told him kind of our story. He's like, I got to get you guys on. And we're like, we don't have enough inventory because it's that type of following what you guys could do. So it's really incredible. I appreciate you kind of having me. And
thanks for being on the ride with us.
Yeah.
And man, always great to see you,
man.
All right. I'm
Always
with
great.
Layne Martin again. He'll be around again next year. Look for him. He does some incredible lectures. He's out there and he's very approachable guy. So, hope we'll have you again soon. And for Dentists in the Know, I'm Dr. Jeff Horowitz. We'll see you next time.